I do have a couple of things that I want to share though, and that's the reason why we're doing this update video. So if it happens to you, you can also understand what might be going on and you don't panic the way that I did when it happened. Hello, beautiful people of YouTube, and welcome to this video where we are celebrating 15 months post-op. It's been a little bit of a while between the 1 year post-op video and today, but I'm happy to be back and reporting everything that has happened. A lot of you have asked how I'm feeling after the surgery, and as you saw in the 1 year post-op, it was really a success. Like, things have been going well. I do have a couple of things that I want to share though. So welcome to this video. If it is the first time that you're here, my name is Mai, and I have been documenting my hip surgery, labrum repair, hip impingement since the day 0. I'm also dealing with some issues on the non-surgical hip, the left hip, including but not limited to tendinosis, muscle strains, bursitis, and all other fun stuff that can happen in the hip. So let me get started talking about the surgical hip, the right hip. All along, I've been saying that this hip has been the one holding the fort together. This is my landing hip. This hip hasn't been bothering me at all since, I don't know, 7 months post-op or something like that. This hip has really been strength of the body until it wasn't. I was traveling for a month, and during that trip, I spent a lot of time sitting. I was commuting for like 4 hours a day. I was working, sitting down, and then, sitting down for the social activities and stuff. So what happened? I came back and I went back to my normal activities. I was walking the dog again. I went to agility with him. We were doing more things. I was working in my standing desk. I was back to having more mobility in my hip. And 2 days later, we're coming back from agility. I'm walking back to my apartment from the parking lot, and out of the sudden, I feel this horrible stabbing pain in my groin area. Horrible, very acute, to the point that I started limping. I had to drag myself to go back to the apartment. Once I got there, I dragged myself to bed and just hoped for the best. I could barely move. It was crazy. It was so painful. And I was expecting that it would get better the next day, and it did, to the point that I could walk a little bit, but throughout the day, things got worse. Thankfully, I had an appointment with my surgeon that same day. So I basically limped to my appointment. And I was wondering, honestly, whether it was a good idea or not to tell him what was going on with that hip, because I didn't want the attention that we were putting to the left non-surgical hip to transition to the right hip, which I knew was doing well. But at that moment, I couldn't even walk. My doctor is a great professional. He really knows what he's doing. He walks in, and his first question is, first and foremost, how is your surgical hip doing? And I lost it, I started crying, and I was like, thank you so much for asking. I can barely walk. This is what's going on. So he did a couple of tests. And one of the interesting tests that he did was that he made me put my leg straight, laying down, and put his fingers, 2 fingers, and told me to hold it and not let him push me down. And as soon as he started pushing, my leg fell. And he explained to me that that was showing that the hip flexor was irritated because I didn't have strength to keep my leg up. He explained, and I think this is something very important for us to know, that in the first 2 years after a surgery like mine, the hip flexor tends to become very sensitive. Maybe you had this, maybe you didn't, but for me, at the beginning of the post-op period, one of the biggest focuses was make sure that the hip flexor wouldn't get irritated and that we wouldn't provoke any tendonitis or anything that would upset the hip flexor. So it looks like that stays throughout the first 2 years after surgery. And he asked, and he was like, oh, have you been sitting a lot? I was like, yes. And he explained that when you're sitting a lot after surgery, the muscle, the hip flexor tends to, shrink. And this is my words. Please take them with a grain of salt. But this is what I understood. Basically kind of shrinks and sticks to the joint. And then when you go back to doing your normal activities, when you're not sitting that much anymore, when you're actually walking, it hurts like crazy. So that's what was going on. He said that given that my hip has doing so well throughout the past 7 months, he wasn't overly concerned about it. I went to physical therapy the day after, And my biggest fear turned into a reality because our attention was completely devoted to the surgical hip. And we did a couple of isometric exercises. Isometric exercises are those where you contract the muscle, but you're not moving the joint. We did basically the exercises that I was doing post-op week 2. So that's how we handled this. It did go away. I think by the time that I went to physical therapy, which would have been potentially 48 hours since the pain had started, I was feeling better. I wasn't limping, which was a success, but I would have pain on and off. Then the next day, I was moving and I had to walk a lot. And my PT basically said, just, I said, do your isometric exercises, put heat, rest as much as you can. But like, if there is no way to change in the dates or anything, like you have to do it. It's gonna upset the hip, but like go for it. So I got some help, thankfully, but I did walk a lot. The hip bothered me a little bit because apparently the hip flexor is partially responsible for walking. So the move of the leg. And I was walking a lot. But I think that within a week, things got better. And now I feel 100% back to where I was. Everything is smooth. Everything is good with the right hip, which is appreciated. Now, let's talk about the other hip. When I was traveling, I stopped exercising. I had to stop exercising for a month. Let's remember where we started. At the time that I left, I was doing strengthening exercises 3 times a week. I was on the ice twice a week. I was lifting heavy and I was starting to jump. I did have pain, a level 3 pain in this area, in the gluteus medius. And when I left, I think I left around month almost 3 after the plasma injection. And the plasma injection, I think, helped a lot because it brought the pain down from a 7 to a 3. But we plateaued there. That's where I was. And when I was traveling and I couldn't exercise anymore, since I was staying there for a month, I thought to myself, well, we have plateaued with this. I've tried all sorts of different types of strengthening. We've done the PRP. I want to do something different. And that's what I did. So I went to this physical therapy place where they did massage and a little bit of TENS and something called shock waves. And they told me, they were like, oh, it's a good idea that you're not exercising right now because you're injured. When you're injured, if you keep exercising, you're getting the muscle or the tendon more irritated and you're never going to heal if you do that. And it made sense to me at the time. I mean, like, if it's irritated and I keep going at it, then I'm irritating it more, right? That's what I thought. After that month, I had marginal improvement. I mean, I still had the level 3 pain, but it wasn't 24 hours a day. It was potentially like 50% of the day or something along those lines. So yeah, I mean, marginally maybe underestimating it. It was a little bit of a progress, but not exactly what I was expecting. And the other thing is that I wasn't doing any activity. So I didn't even know if it was because I stopped exercising or because the physical therapy was actually working. So that's why I decided to schedule the appointment with my surgeon when I was back, because I wanted to ask what was going on. Like I've been feeling this pain here in this area, in the gluteus medius, for 9 months at a time. At this point, it's 10 months. And it's still here. Like this has taken longer than the freaking surgery to heal. So he saw me, he did a couple of tests. When I went, I had pain here, and I also had pain in the depths of my butt, which is something that I have told you about, like here, like this area here, in the sit bone, basically. So he did a couple of tests, and he said, okay, we know that you have tendinosis in the gluteus medius, and he was suspecting that I had ischial bursitis here. So apparently there are 2 bursas, big bursas, trochanter bursa, ischial bursa, and like other tiny bursas around the glutes. He thought that was irritated. So, and that pain at the time was stronger than the pain on the side. So we decided to go for a cortisone shot as a diagnosis more than a treatment. Because if the cortisone would stop the pain, then we would know that that was the root of the pain. If it didn't, then we would have to keep investigating. As a secondary consequence of the effect of the cortisone, the inflammation should go down, and that will help us get over this bump to go back to physical therapy and strengthening. And he kept saying, he's like, you need to get stronger, you need to get stronger, you need to get stronger. And I'm like, but I am strong, or at least I was strong before I stopped exercising. At the time, my PT said that she's never seen glutes as strong as mine. like in her whole career. Like I had very strong glutes and I was so proud of it. Call them iron glutes. I was so proud. And so I told him, I was like, I mean, what else do you want from me? Like, I've been strengthening as much as possible. Why is this not working? So one thing that he explained to me, using the example of the other leg that he could pull down with only 2 fingers, was that when you're in pain, your brain turns off the muscles that are in pain. So for example, with a hip flexor in the right hip, my brain had turned off the hip flexor, which is responsible for holding that position. So it was completely weak. My understanding of the explanation that he was saying is that when I am doing PT, I am forcefully turning on those muscles because I am engaging with them. I'm like glute, 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 glute. And we work them and they are strong. But during my normal day, I am not constantly thinking about my glutes. So they don't fire and they don't work, which makes other tissues compensate for it, other muscles and the tendons, and that could cause irritation. So that's kind of the way that I understand this is working. So the idea is that if we help with the pain, that the muscles will start working and we can keep strengthening to actually get the muscles to work and not the tendons or the other soft tissues, and that should help. As of now, I am taking an anti-inflammatory pill and we're expecting to see how I feel in 2 more weeks to decide whether I'm doing a second PRP injection for the glute medius because I still have pain here. The cortisone had nothing to do with this one here. Cortisone went to the bursal here. And in the meantime, I've been doing isometric exercises for this hip as well. And that is when I learned by my PT and other PTs that don't treat me and doctors that it's not a good idea to stop, especially if you're an athlete. Don't stop. What you usually do if the injury is getting worse or it's getting irritated, you modify. So you can still be doing exercises and keep with the strengthening, but not irritating it. You just modify. But I stopped, and as I'm saying, like I didn't willingly stop. But it was really annoying to hear from this PT clinic their affirmation that yes, I was right, I shouldn't be exercising. Because now I have to start from scratch. Because we don't want the hip to get upset. So we're doing isometric exercises. And just this week, finally, we're starting to do some more complex exercises, like a single leg squat to like a very, very high position. I was pulling some weight. I was pushing some weight, some balance exercises. And I'm back on the ice for half an hour once a week. But we are going back to it very slowly, very, very slowly. And that is very frustrating. So if I wouldn't have stopped, at least we weren't starting from zero again. And that's the other funny thing. I actually went skating. And since I'm only allowed to stroke back and forth and very basic things, I didn't think to wear any padding or anything. I'm skating, I'm going backwards, and I fell on my left glute. Because, of course, like why would I not fall on my left glute? On my left glute! That was kind of a setback. I feel like the glute in general was feeling not too sore, but the issue that I had was in the front. The groin area took a hit. I was in pain for like solid 3 to 4 days after that fall. But after that, we were able to get back to exercising. I've skated twice since then. I feel okay-ish. So that's good, little by little. So that's kind of the update. That's how I'm feeling right now. One thing though that I also wanted to share with you is that I am trying to learn this concept of letting go of the pain. I am hyper-focused on this hip. I wake up and I think about the hip. I sit down and think about the hip. I'm walking, well, I think about the hip. Any move that I do, I think about the hip. And when it hurts, I think about it even more. And I am so hyper-focused on the pain that I think that that's bringing a toll to my brain and also my body. I was watching this video today that was explaining a little bit about like the psychology and the way that the brain operates and sends signals to the body. And it was talking about this, placebo effect and how all of that works. And when you're so focused on the pain, you not only feel it more, but you're not allowing the body to heal. One of the things that they were talking about in the video was about this experiment where people thought that they got a knee surgery, but they didn't. But since they were thinking that the surgeon had already fixed their knee, they started feeling better. Like the brain stopped sending cues for inflammation, for example. and stopped focusing so much on the pain, and they were able to go back to a normal life. So I'm really trying, and I know it's super hard. I'm with you. I'm in your boat. I know that what I'm saying can be ridiculous and can be really hard to implement, but I think it is important. We need to stop hyper-focusing on our pain, because otherwise things go south. Things go south really quickly. And I don't think we deserve a life where we're only thinking about pain. That's not okay. And if we can help somehow, at least by reprogramming our brain to give us a break, I think it's worth a try. And I saw this very nice illustration. I'm going to put it here. That basically says sometimes letting go heals more than holding on, or something like that. And I think that's really powerful. And I think that's what we should strive for. Let it go. Let's trust that what we're doing is as much as what we can do, that what we are doing is enough. That we are doing everything we can. That we have the team of people that worry about us, that know what they are doing, that we're putting in the effort, that we're eating, that we're sleeping, that we're resting, that we're doing everything. Let's give us some credit, and let's hope, we're doing everything we can. Everything we can. And the rest is up to whoever you believe in. And I think it's really powerful to let go of the control and the 100% responsibility that we think we have to fix what we're dealing with. And with a happy note, I'm going to end the video here. I hope that your recovery is going well. If you're in the first stages, let me know how you're feeling. If you're crossed the 1-year mark, how are you feeling? And I would love to hear if anybody of you is going through something similar with the other hip being upset and it taking longer than the surgical hip to heal. Thank you so much for staying till the end. I will see you in the next video. Bye.